Yes. So hello and welcome to our special COVID-19 session number 32. This is a special series of our COVID-19 sessions that we have dedicated to the fight against the pandemic. My name is Anafi Mataka. I'm from ASLM and I'm delighted to be your host today. Today is a landmark day and today's topic is special. We are here to launch the SARS-CoV-2 antigen rapid test training package. I must say it's nearly a year now with the world engulfed with the COVID-19 pandemic. To date, we know that testing has been the bedrock of this fight. Unarguably, testing has been the best intervention, of course, after the availability of a vaccine, which we are all hoping it will be out soon, thanks to some developments that we have seen the past few days, particularly around Pfizer and the rest. For the most part of testing for the SARS-CoV-2, detection has been mostly by real-time PCR. But as we all know, it has come with its own barriers such as turnaround time sometimes, barriers such as capacity sometimes. But we are also glad that just over a month ago, global health partners put heads together and then announced a historical partnership to make available new technologies that are actually simpler, faster to perform, that is specifically the antigen RDT. Although we acknowledge that we have acknowledged in several sessions that we have done previously, that the sensitivity may not be as good as the molecular tests, it offers the possibility of rapid, cheaper, and early detection, which will be key to achieving the fight. To achieve this, countries need a rapid rollout, and the training package that has been developed by ASLM, Africa CDC, and global health partners will be key. Today's session, as usual, will be 1 hour long, which shall begin with some remarks, followed by a walkthrough of the training package. We are delighted to have a special lineup of global health leaders, one of whom in the name Dr. John Kingerson, the director of the Africa Centers for Disease Control and Prevention, Africa CDC, has been a recipient of the Global Gatekeeper Award, which recognizes remarkable individuals for taking action to achieve global goals. Dr. Kingerson will be joined in the remarks section by Mr. Nowile Ndlovu, who is the Chief Executive Officer of the African Society for Laboratory Medicine. And you will also be joined by Dr. Simon Antara, the Executive Director of the African Field Epidemiology Network. To begin, let's hear what this means for the continent, how this package contributes to the African Union Pact Initiative, the partnership to accelerate COVID-19 testing, what it means for member states. Colleagues, I'm honored to call upon Dr. John Kingerson, the Director of the Africa CDC, to give some remarks. Over to you, John. John, you're on mute.
Yeah, can you hear me?
Yes.
Good. Thank you so much for the kind introduction, and greetings, colleagues from the Africa Centers for Disease Control and Prevention in Addis Ababa. Let me, first of all, start by recognizing the very strong partnership that exists between the Foundation for Innovative New Diagnostics, FINE, the World Health Organization, and the Global Fund and UNITED in making possible this, the availability of this very new and innovative tests. And then I really would like to use this opportunity to amplify the exemplary nature of the cooperation that FINE, UNITED, Global Fund, and WHO have exercised with with Africa CDC in the leadership leading up to this event today in terms of the launch. Let me then also really strongly recognize and congratulate the ASLM, the African Society for Lab Medicine, for the extraordinary role they have played throughout the start of this pandemic in moving us forward with diagnostics, and also very grateful, express a sincere appreciation and for the partnership that they have developed with the Africa CDC. I think it is always our collective goals and aspiration to see institutions on the continent develop and work in a network to address a common challenge. And ASLM has demonstrated in exceptional circumstances that this partnership can actually happen and help advance us and take us to where we have to be. I agree with the previous speaker that today is a unique day for all of us, because we are going to be discussing and rolling out / training on a new product, what I call the second generation diagnostics for that are critical for us to fight this COVID-19 pandemic, which I must say that we have not seen the light at the tunnel yet. As a continent, we have done remarkably well, but the journey is it's a long journey, will be a long journey. So we need to prepare ourselves for a marathon and not a sprint. The reason I consider this to be a turning point in our fight against COVID-19 is several-fold. The PCR tests that were available and are still available and considered as gold standard is extremely cumbersome to roll out rapidly. And also in the context of the strategy we roll out, which is the need to test, to trace, and to treat. So that in all of these to be effective, we need a test that will allow you to test, identify anyone who is positive and do the needful, that is with those actions that are indicated, i.e. Quarantine people or isolate them and follow up with their contacts. So I think with the antigen tests that we will be discussing today and the launch, it will provide that a new generation tool. I use the word generation deliberately because I want to manage expectations, that people don't think that we have the perfect product. We are not looking for the perfect product. When you're at war, you go to war with what you have and not what you need. I think this is the war against COVID requires that we fight it with everything that we have and not necessarily wait for the best weapon. PCR itself is not perfect. The PCR testing itself is not perfect. We should just keep that in mind and really work hard in the context of the constraints that we have in our settings to really push countries to use this test as much as possible. An ideal test for either the second or fourth generation test will be a test that has the following characteristics: is easy to use, is easy to roll out, is affordable, and is also scalable. I think those are the elements that, and with, of course, at the center of that has to have quality. And I believe that the current generation of the antigen tests, which are characterized as the first generation of antigen tests, meet most of these criteria, and will continue to learn and improve. And I remain optimistic that this will create a significant impact in a manner in which we will continue to fight COVID-19 on the continent. Let me just conclude then by once more thanking the tremendous partnership that has developed across this important product. Again, FIND, the WHO, the Global Fund, UNITED have all been extraordinary partners in this, and speaks to the cooperative spirit and the collaborative spirit that we want to see happen. And I will just conclude by acknowledging the efforts that our own team at Africa CDC, led by Dr. Yeno, have been working. And through the task force, the AFCOT task force, which most of you do attend every so often, they've really invested tremendous amount of energy, time in working with ASLM and WHO FIND. So, thank you and your team in a very special way, in the way and manner in which you have pushed this agenda forward. So thank you very much. Over to you.
Thank you very much, John, for those wonderful remarks. Indeed, we need to move on. Moving on with the session, I would like to call upon Mr. Nqobile Ndlovu, the ASLM CEO, to also give us his remarks and tell us more on what this training is about, what the certification will be about. Over to you, Mr. Ndlovu.
Thank you so much, John, for making time to be here. And thank you so much even for the excellent remarks and also for the clarity in terms of your vision and what Africa CDC is trying to achieve for the continent. I would like to assure you that as ASLM, we are committed to be supporting you all the way and make sure that this is happening. I know you need to jump off anytime now. I know your schedule is very busy, and at any point in time, please feel free to jump off this call. So friends and colleagues, good morning and good afternoon. So my talk is going to be focusing on this one slide that you are seeing projecting there, because this is the reason why we are here today. It's been nearly 6 weeks since the launch of the global partnership to make available 120 million quality COVID-19 rapid tests for low and middle income countries. In this partnership, a commitment was made to initiate the rollout of these tests in Africa starting in October 2020. Today, I am happy that ASLM and Africa CDC, in partnership with CHAI, Afinet, AMREF, and Last Mile Health, have come together and have developed a training package to support this commitment to initiate the rollout. We are indeed excited with the recent introduction of the SARS-CoV-2 antigen rapid testing. We see that this has provided countries with more tools and opportunities to better control the epidemic and to possibly open borders safely in their economies. Whilst we acknowledge that the real-time PCR is the gold standard in detecting SARS-CoV-2, we note, however, the capacity for PCR is not readily available in many settings. And where available, the issues of long turnaround time become challenging. The availability of high-performance antigen rapid testing provide the opportunity to truly deploy testing for more effective epidemic control and to expand testing beyond the more restricted and traditional settings. But to realize the full benefits of the antigen rapid testing, its introduction in countries will need to be accompanied with a high-quality training program to ensure countries are able to widely use these innovative technologies and produce accurate and quality-assured results. In the absence of such a training, health workers will have challenges in collecting the right specimens, using the correct procedures, properly conducting testing, interpret results, and even troubleshooting. Given that these antigen rapid tests can be used outside of laboratory settings, that is, even by non-laboratory healthcare workers, quality training and competence to conduct the tests, including sample collection, and to produce accurate results needs to be ensured. So on behalf of the partners, the African Society for Laboratory Medicine, ASLM, Africa CDC, CHAI, Afinet, AMREF, and Last Mile Health, we would like to announce the launch of an accessible and easy to download SARS-CoV-2 antigen testing training package. This training package seeks to support the Africa Union's partnership to accelerate COVID-19 testing, the PAC initiative that was launched in August 2020 to mobilize experts, community workers, supplies, and other resources to minimize the impact of the pandemic on the African continent by testing, tracing, and treating COVID-19 cases in a timely manner. I would like to thank Africa CDC for their leadership and guidance to make sure this training answers the calls and needs of member states. Let me also thank the Clinton Health Access Initiative, CHAI, for their tireless effort and technical input in outlining these training materials. I also want to thank Afinet, AMREF, and Last Mile Health for the resources that they've shared and helped to inform these training materials. The training package that will be available to all Africa Union member states aims to support the scale-up of COVID-19 testing through accessible and adaptable SARS-CoV-2 antigen testing training package. It is expected that this training will provide guidance on appropriate testing strategies to implement antigen testing. Number two, it will help to ensure the appropriate levels of quality assurance that are in place for the deployment of antigen tests. Number three, it should ensure that it will strengthen the competencies, knowledge, and skills of healthcare workers to perform antigen testing for COVID-19 diagnosis and screening in a safe, reliable, and professional manner. Number four, should provide technology-specific training materials so that trainees are certified to use specific antigen tests. And lastly, provide knowledge and expertise to member states on the role of antigen rapid diagnostic tests for the COVID-19 epidemic response. So countries will be able to download and print for their face-to-face in-country trainings. We will also be launching a self-learning or digital e-learning platform so that anyone can use their computer and tablets to learn wherever they are. At the end of the training, ASLM will provide certification, that is, certificates of competence, for all the attendees that successfully complete the training. This course will also be accredited with CPD points. We are also happy to announce that there will be continuous support to countries on the rollout of these trainings and the follow-up testing through the establishment of a community of practice. Through this community of practice, we will establish a series of webinars and follow-up discussions on specific topics from the training itself and other rising topical issues, as well as to provide a forum for sharing updates and any field experiences between experts and implementers within and across countries. Details of that are going to be shared in terms of the platforms for networking and support. The training package that we are launching today is currently available in English, but I'm happy to say that French and Portuguese translations are in progress and will also be available in the next coming 2 to 3 weeks. It's also important to indicate right now that there is the first regional training that will be planned by Africa CDC that will be taking place at the end of November. And even as we speak, there are plans that are underway to kick off in-country training of trainers in a number of countries in the coming weeks. As I close, I would like to acknowledge the following partners who have made this possible: Unitate, the Bill and Melinda Gates Foundation, and Elmer Philanthropies for the support and the resources in developing this training package. Lastly, I want to thank our colleagues from WHO and FIND for being generous in sharing some of their materials and also providing feedback and comments. Finally, my 2 key takeaway messages. Number 1, I believe that we have an opportunity here as a continent to stay ahead of the pandemic, given the innovative tools we have today that we did not have earlier this year. My appeal for the countries is to facilitate this introduction and also the training so that we move with speed to address this pandemic. Number 2, without treatment and vaccine, testing will remain the main public health intervention to control this epidemic. These rapid tests will enable us to execute effective testing programs and keep the pandemic in check. Thank you, and over to you, Anafi.
Thank you, Mr. Ndlovu. Keeping the pandemic at bay indeed. To move on, we want to also hear on how we are going to move on and close this loop. We will now have competent personnel. We look forward to having the results being issued, being utilized. We also need to now understand how this is going to help control the epidemic, some say from testing to public health response. Colleagues, let me call upon Dr. Simon Antara, the Executive Director of the African Field Epidemiology Network, to also give us his remarks. Over to you, Dr. Simon.
Thank you. the Director of Africa CDC, the CEO of ASLM, the Clinton Health Access Initiative, AMREF, Last Mile Health, all the partners in this training package, all protocols observed. Ladies and gentlemen, I bring you greetings from the African Field Epidemiology Network. We are happy to be part of this launch and happy for the opportunity to make a few remarks. More so, we are happy to be in the partnership that is working to roll out this training. Louis Pasteur once said, and I quote, "Without laboratories, men of science are soldiers without arms," unquote. How true. Indeed, without laboratory capacity, we flounder in the dark. We shoot not knowing what the target is. Ladies and gentlemen, in the face of the numerous public health challenges confronting us, the need for enhanced laboratory capacity has never been greater. While acknowledging that over the years, a lot has been done to improve laboratory capacity in sub-Saharan Africa, I cannot fail to note that a lot more needs to be done. We are very far away from arriving. In many countries in Africa, the capacity of laboratories to help mount a valid, formidable, comprehensive, and precise response to public health emergencies is limited. And if there was any doubt about this, the arrival of COVID-19 in sub-Saharan Africa clarified it. Indeed, when COVID-19 arrived in sub-Saharan Africa, the report was that only 2 countries initially had the requisite laboratory capacity to diagnose the disease. The Africa CDC promptly intervened to ensure the availability of such capacity throughout Africa. Again, in our continent, the established laboratories are concentrated in urban centers with very little capacity in the peripheries. Such skewed distribution of laboratories, and for that matter, laboratory capacity, has grave implications for our ability to control widespread public health emergencies such as the COVID-19 pandemic. As already been said, PCR tests, the gold standard, requires established laboratories and laboratory experts, and these are not available in remote settings. It is estimated that the time taken to deliver PCR results ranges from 24 hours to 10 days. Such delay in getting laboratory results is inimical to an effective public health response to the pandemic. Pandemics are not just public health emergencies. They are political, economic, and social emergencies. Our ability to respond promptly will determine the level of mitigation. Having a test that is easy to apply, easy to interpret, a test that does not require high-level laboratory expertise, a test that can be applied in the most remote setting, and the results generated right there and then, the availability of such tests is critical for prompt response decisions. While acknowledging that the RDTs are not a replacement for PCR, they are critical and affordable tools for decentralizing testing. They have the potential to revolutionize the trajectory of our response to the pandemic. The results of the rapid COVID-19 tests could be used in making a number of response decisions and doing so promptly. For example, the results could be used for the confirmation of outbreaks even in the most remote settings. RDTs, by virtue of their ease of use, are well suited for deployment for active case search. Response decisions, such as isolation and patient care, will be made promptly. In addition, the results would be useful for contact listing and tracing. All these uses will positively impact the response and enhance our chances of being a step ahead of the pandemic and controlling it. This project is such an important undertaking, particularly in our setting. And once again, I would like to pledge the commitment of my organization in this joint effort. Thank you.
Thank you very much, Dr. Simon, for those wonderful remarks. Ladies and gentlemen, we want to move ahead with the program. Keep your comments or questions coming through into the chat box, and we will address them immediately after the next stage. For those that have joined, I would like to remind you that we do have French interpretation here in this session. So please feel free to go and choose the language of your choice. Allow me to call upon Mr. Silva Mashate, who is an ASLM project manager, to take us through what this package is about in a few quick slides. Over to you, Silva.
Thank you, Anafi. Thank you, everyone. Thank you, the previous speakers. Like Mr. Anafi has announced, my name is Mashate Silva. I work for ASLM. In the next few minutes, we are going to discuss the summary of the overview of the content of the subject that the previous speakers have just been talking about. It's going now to give us the flow and how the content of this COVID-19 antigen rapid diagnostic testing training package has been put together. So in the next few minutes, join us and you go through this. We are delighted to acknowledge the support provided by the different partners, Africa CDC, the African Union, ASLM, CHAI, AMREF, Last Health Mile, and then Affinit. So this training package, we have a goal. Like the previous speakers have said, given the pandemic, the goal of this training package is to support the scale up of the SARS-CoV-2 testing among member states. We would like to make this testing accessible, adaptable, such that when the training is available, the services can be available to all our people in the continent. And essentially, there are three core objectives for which this training package is focused and looking forward to address. The CEO ASLM already mentioned this, but we can go ahead and re-emphasize them. The COVID-19 antigen RDTs is fairly new. So the first objective, we would like to ensure that we enhance quality assurance as we go out there to roll out the testing of COVID-19 using these RDTs. And given as a training package, we'll focus on ensuring that we strengthen the competencies of our service providers, such that as they do this work, they remain safe and they do this work in a professional manner. And again, like it has been highlighted, we are looking forward to provide knowledge, expertise to all member states, especially in relation to the rollout of this diagnostic testing using these RDTs as we respond to the pandemic. This particular slide is such an important slide that summarizes this training package. And for people who are listening in now, we need to listen this carefully and then appreciate such that we appreciate the next steps. So this training package has essentially three components. The first component is the overview package. This overview package is designed for leaders, is designed for policymakers, is designed for the high-level stakeholders who are going to ensure that the facilitation and overseeing of these COVID antigen RDT materials are given out to the countries, are used, and appropriately. This overview training package is accessible and downloadable from the website. Free download, you just visit the website and you have access to it. The second component of this training package is the trainer of trainers package. Mr. Love already highlighted that Africa CDC is organizing a training of trainers at the end of this month. This particular package takes care of people who are going to train people out there to go ahead and train the end users of these RDTs. It is designed for the trainers. This particular package, compared to the previous overview package, provides the details of the technical aspects of the antigen RDT. It's going to be available to qualified health workers, laboratory personnel, including other personnel who are non-lab but are trained to ensure that they go ahead and have this service available to our people. We need to highlight, however, that this trainer of trainers package, the content we have there that partners have put together that we are discussing, we need to highlight that these materials are adaptable according to in-country needs. This is important to note. You might realize that in the trainers package, we have indicated the ratio of trainers to participants. You might go to a certain country and their conditions are different. In that case, the respective countries can modify them to suit their need. The other third package that again was highlighted is the end user package. We are aware that the COVID-19 information is evolving every minute. So we are going to have available a package for people out there who are not available to sit in a class, but are willing to learn more and learn about the COVID antigen testing. These are going to be accessible and they are downloadable, could be downloaded on a computer, could be downloaded on a phone. So these are the components, the three components of this training package. How is this training package structured? It is structured in three large sections. The first section, given that this recommendation to use antigen RDTs for COVID testing was recommended recently, we are having a trainer of trainers course training, which is going to take place regionally. It's being organized by Africa CDC. It's taking place at the end of this month. These trainers of trainers will go back to their respective countries and they are going to conduct in-country training of trainers. And these in-country trainings are going to be conducted with the stewardship of the respective ministries of health, with support from ASLM and all the available partners. The in-country trainers will conduct this. And then the third level is the end-user training. The end-user training, we are talking about those health workers who are at the forefront of the testing, those health workers who are in the communities testing, those health workers who are in the facilities, they'll be trained, and that is the third level of regarding the structure of this training package. In terms of the program, this training package is programmed in three main sections. The first part of the training is a class kind of didactic theory training, which we have indicated to take at least 1.5 days. And then there'll be a practical session, which will take about half a day. Now, we need again to highlight that this period allocated to these core program sections of this training, again, can be adapted depending on the country needs and the country situations. At the end of the training, of the theory training and the practical training, we will have certification. All persons, all participants who successfully finish the didactic training and the practical training and are deemed competent by the respective trainers will be awarded a certificate of training and competence. However, there are conditions they have to meet before they get this certificate. The first condition is all participants must have 100% attendance. The theory assessment, they must score a minimum of 80%. And then for the practical, the score is set at 100%. The score for the practical is set at 100% because this is one of the most critical components of this training. Because when you don't take off a proper sample, then you can't get a correct result. If you cannot do proper testing, you can't interpret. So for that reason, the practical pass mark has been set so high. And this summarizes the layout that we will have the training, didactic, practical, evaluation, and then the certification. The didactic training, we have planned and proposed to have it as a physical, but given the different needs of different countries, in cases where it is applicable, virtual remits can be made. We need also to highlight that in this training package, given that the COVID-19 antigen RDTs are fairly new, this is a new technology, we recommend that the training of the practical part should be done by the respective RDT manufacturers or suppliers or the authorized personnel. This is a very, very important slide. It provides us the content summary, the course, this training, what does it have in general. This training package has 11 modules from module 1 to module 11. These 11 modules constitute the key topics that are to be studied or to be taught in this training package. The last bit is the assessment, where I talked about the assessment of the participants to ensure that they are competent and have gained knowledge and skills. However, I would like to highlight that this particular content highlighted here, listed on this slide, we have an additional module which is not here, which is module 00. This module 00, you'll be seeing it later in the next slides, is a module which has guidance to the trainers, guidance to the people who are planning and to conduct the training. So it is called module 001. It has issues how modules should be handled, how facilitation should be done. But essentially we have 11 modules: the introduction to the training, the antigen testing strategy, quality assurance, safety, sample collection, and all the other data, diagnostics, inventory management, quality assurance, test flow. And we have something very important on module 11. After doing all this testing, having people treated, we need to know how is the epidemiology evolving. That's why we have the module 11, which is the basic epidemiology, converting and looking at from the testing to the public health response. Because that information that has been generated and compiled in module 7 now helps governments and stakeholders to pave a way forward on how to respond to the pandemic. This slide is a summary of all the things that will have happened. These are the key certification steps. If any participant is to get a certificate for deeming him or her competent to perform COVID-19 antigen rapid diagnostic test, these are the steps. The first step we have already highlighted in this section. When you start, you need to attend a training whose pass mark is 100%. The assessment will take place regarding the theory. The practical, we have split it into two because the practical component has two critical areas: sample collection, and the participants must demonstrate that they have good competence to collect the samples correctly. The second part of the practical is the testing and interpretation of results using the respective RDTs. And again, the score has to be 100%. Regarding certification, after the training, and this is critical, when the participants go through the training, the trainers will submit the names of the participants to ASLM. The details of all participants who have participated in that training. The records will include attendance lists, their performance, and these records will be submitted to ASLM via email. We have tools that we shall be showing you where to find them, where all this information is supposed to be captured. And when this information is emailed to ASLM, the secretariat at ASLM in charge of this response will review and confirm if the certification recommendation is okay. And then the certificates will be awarded to the successful participants. They'll be sent by either email, and where applicable, we shall use post-mail. After certification, there's one core component which is very critical, and that is the follow-ups. All participants are not going to be left right there. We have a follow-up after certification program. We need to track the people who have been trained. We need to track people by email. We plan to have social media platforms where we keep on getting feedback. We know that people will be getting different challenges here and there. However, we may not know if we don't have a follow-up loop. So for that reason, we shall have a follow-up program for all the participants that will have gone through all this training. After appreciating the layout and the structure and the design and the components of this training, the next question one would ask is, so how do I access these materials? The CEO at ASLM has already highlighted that these materials are going to be free, available, and accessible on the ASLM website. We have a link to which these materials, one, if he or she wants, can access them. This is the link. You just have to, provided you have internet, you have a system that can get these materials, just get this link. and then you'll access the ASLM page. In the next few slides, we shall be highlighting what your expectations and how the web page is structured such that one doesn't get mixed up. When you click on that link, it's going to take you to what we call the landing page. This is what will be the landing page for this training package. It is COVID-19 courses and training. And you realize that this page has many icons, but we have this icon here, which is COVID-19. So this landing page is where you have the information, and it tells you, describes the different courses if you want to learn about COVID-19 guidelines and the rest. So when you scroll down to this page, on the landing page, you are now going to land on the next section, which essentially talks about the COVID-19 antigen training materials. This is important. When we were beginning this presentation, we indicated that the first package that we call the overview package for high level, it is right here. It is called the SARS-CoV-2 POC training package. When you click on this icon, it will download for you the entire package describing the different components of this training. However, if one is interested now to view the training materials, remember the training materials we talked about, the 11 modules. You come right on this icon, and then it will take you to the next page. This next page now takes you to a section where you have the training of trainers packages. Again, it's critical to observe what's on this page. You realize that this is COVID-19 POC antigen training. If you need any information to contact us, there's this icon. However, down here we have the full training package can be downloaded here. Individuals can be blah, 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 and all the other things. So if you'd like to download the entire training package, then all you need to do is to click here and the materials will be downloaded. However, we need to highlight that as we visit this page, it's important to understand how the pages are laid out. The layout of this page is designed in a way that we have the website content layout, and then we have how each of the modules is laid out. So you first visit the first part, and the website is laid out in a way, the TOT package website is laid in a way that we have a section where you have the facilitators or trainers guides. These are packages that have details on if stakeholders would like to prepare for a training, what they do. Then it gives you good practices for TOT, introduction and good facilitation resources. Now, these first two tabs talk about the general guidance to the trainers. Then the next section talks about all the modules from module 1 to module 11. And remember, we talked about competence assessments. The next section takes you about what do you have to do? What resources do you need to do? Competence assessment. And then the certification resources. This is important. When you open this course module section, each module from module 1 to module 11 is structured in a way that we have the module title. Under the module title, we have two sub-tabs. The first sub-tab is the presentation. This presentation provides you details, the PowerPoints of the content of that material. But remember, all these presentations, all these modules, they are additional supplementary materials that you may need. I'll give an example. When you come to sample collection, we have a PowerPoint for sample collection, but we have additional supplementary materials like videos, like reference materials, like text materials. Then you go to that tab and then you obtain those materials. So that's how the page is structured. So for the training of trainers package, I needed to highlight that we have the trainer facilitator guide, which is here, which you can just download. We have this training of trainer or facilitator guide. There are two. There's one for the master trainers, and then you have one for the trainers. This is important to note. And remember, we highlighted about the module 00, which is TOT, which gives guidance on introduction to TOT and good facilitation. Again, there's a presentation and then the supplementary materials. And then next here, it summarizes now what do you expect when you go to the modules. We indicated that for each module, we have a title. This is an example, but all the other modules from module 1 to module 11, they are structured like this. This is an example of module 1. Module 1, we have the presentation, then we have the title, then we have the presentation, and then we have the supplementary materials. So this is important to know that this is how all the other resources and materials are actually structured for all the modules. And then the part for competence assessment, we have the materials to download, the questions, and then we have the answer keys, and then the certification process, and then the form we talked about that the trainers will submit to ASLM right here. And then lastly, what are our post-training and certification plans? We have already highlighted, we have immediately after training, we need to follow up, monitor progress, and we are going to create groups, discussion groups for all the trained, the mentorship programs, and then we highlighted about the in-country trainings. Key to note that the information about COVID-19 is evolving every day. Every minute we have information. So for that reason, we have a whole component on the continuous updating of this information. We expect more to come. I'd like to stop here. Thank you so much. And for that, before we end, we need to appreciate and acknowledge all the different partners who have made this possible. Thank you so much, and back to you, Anafi. Thank you.
Thank you very much, Silva, for the wonderful walkthrough. Colleagues, it's time to take a few questions that came through into the chat. We are excited to see this coming through. So I'll take maybe one of the first few questions that came earlier on from, I think this is Ernest Makoka, who is, I think this will be representing probably what the rest of the countries are actually asking. He says, hi Ndlovu, do you have a timeline for TOT on antigen SARS-CoV-2 in Kenya? I know you touched a bit of what is already happening in some countries. Over to you, Ndlovu.
Thank you so much for that question. So currently we have one TOT that is planned by Africa CDC. I hope Yenyu is online. Anafi, can you check if Yenyu is online? You can speak to that, but it's going to be bringing a number of countries, and I would like to assume that Kenya is part of that. But besides that, we are also encouraging even countries to also start organizing their own in-country TOT. We have got facilitators that will be ready to help even to set up a TOT in Kenya. So if you can reach out to ASLM, we will be happy to help you set off even a TOT there in Kenya so that you can also start rolling out this antigen testing. So we are happy to work with a number of countries. I know that right now the number of countries that are going to be attending the TOT in Zambia organized by Africa CDC is not all the African countries. So while that is happening, we are also encouraging and working and supporting other countries to get started. Like I said, there are a few countries that already have started. Last week on Friday, we were talking to another country. This week also, there is another country that is preparing to get started. So even Kenya can start right away. And also as with Yenyu, who's also leading that effort to build that capacity for the continent. I think I would like to invite Yenyu to make some comments on that. Over to you, Yenyu.
Yes, Yenyu, are you there?
Yes.
Maybe as you are coming through, maybe also address this one where they are also talking about will Africa's CDC be updating the testing strategy to include algorithms? Thank you.
Okay, great. Thank you, Anafi. Thank you, Ndlovu. Thank you, everyone, for joining. This is a very, very important step forward. As you know, as also, the Dr. Nkengason, the Director of Africa CDC spoke, also reflected by Ndlovu. It's really now an access issue. It's really, scaling up the testing, which is really, the main public health intervention in response to COVID. So I think this will be a landmark achievement in terms of coming up with this very, very important training package. So the training in Zambia will be last week of November 26 to 27. We are organizing that one in collaboration with many of the partners that you saw here, and also Zambia National Public Health Institute and the Ministry of Health of Zambia. In fact, the minister himself will be opening this training, which is really, indicating that this has high level of significance has been attached to it. So initially, because of the regulations on gathering and so on, so we are not taking all of the countries, so only few countries will be attending that meeting, around 14 countries. However, the availability of this training material will be key, so maybe we are also trying to find a mechanism, working with the partners, how countries can organize a country-level TOT, using the experts already there. So that's what we are planning. So Kenya will be part of the training in Zambia. So we have sent invitation, and I have also sent nominations. So they will be part of that one. So the team coming from that training combined with in-country experts, I think it will be easy to organize TOT. So thank you for the opportunity. We are really happy to collaborate with ASLM and many other partners to move this agenda forward. Thank you.
Thank you, Yenu. Thank you again for that clarification.
So one thing, sorry, Anafi, one thing that I forgot is on the strategy.
Yes.
The testing strategy, it will be part of this training package. And we are also working as a team to come up with a guidance, a very short guidance on the use of antigen testing in African setting. Thank you.
Thank you very much, Yenu, for that. Silva, there's one clarification you probably may need to make. Does this training have a high-level overview for stakeholders, for high-level stakeholders?
Yes, thank you, Anafi, for that question. Yes, indeed, we have that package that we talked about of the high-level overview. We have a full set of materials prepared. If one or a stakeholder would like to have it as a training to these high-level stakeholders, yes, it's already available. And it's already downloadable now as we talk. It's available and it's free access. It's right there. Thank you. It can be used.
Thank you very much. We acknowledge quite a lot of questions, very important questions indeed that have come through from requests around proficiency testing panels, the issues of quality, the issues of post-market surveillance, whether we will be distributing these, the theory pre and post, whether the training is automatically savable, whether if there's any plan to really just use virtual reality tools in conducting these sessions. Some of them are actually offering tools for this to be used by countries. So we will be getting in touch. I've just tried to summarize all the sort of a broad list of questions that we are getting into the chat. These are important questions indeed. So what we'll do here, we will probably have to sit and answer one by one and be able to share with you, I think, all the questions that have come through, recognizing that we are right at the top of the hour and we need to be closing. It has been an important session indeed. We're all looking forward to the rollout of these tools and seeing ourselves making use of them, as Dr. Santara has mentioned. Ultimately, we want to see this contributing to the larger picture of controlling the pandemic and informing the policies as well. I'm going to be sharing with you, as usual, the slide that shows the certificate for those that need to go ahead and download any acknowledgement of having spent the last hour with us here. You simply need to go to the ASLM Academy, which is the same site that you are going to be also finding these training materials. So we look forward to seeing you visit there. Please feel free to get in touch with us for everything that you may need regarding the academy itself, as well as the package that Silva has just mentioned. I would not want to take much of your time, but just to appreciate our keynote speakers, Dr. John Kingerson, Mr. Ndlovu, as well as Dr. Santara, and also thank Silva Mashate for taking us through. Thanking you all for coming through and witnessing this historic moment with us. We look forward to working with you and everyone else until we win the fight against the pandemic. This, what's left for me is to wish you a good afternoon, good morning, or good evening, depending on wherever you are. Till we meet again, thank you and goodbye.